So there are multiple targeted therapies currently under investigation in CLL and non-Hodgkin lymphoma. In CLL in particular, you would see a lot of data from non-covalent BTK inhibitors such as Pirtobrutinib and Nemtabrutinib, which are really showing very good efficacy, particularly in patients who have progressed on covalent BTK inhibitors. Furthermore, there are some novel agents where we don't have a whole lot of data yet, but which hold great promise. Among them, for example, BTK degraders. Those are drugs which are designed as a combination of so-called a hook and a harness. A hook links to the kinase of interest. In that case, it's going to be BTK. And the harness then links to a ligase or an E3 ligase, which will then degrade the whole complex. And thereby you will lose BTK activity because BTK is simply degraded. And so these drugs are expected to work in patients who have progressed on BTK kinase inhibitors. The data there is very early, and we do not have yet a whole lot of clinical reports, but multiple pharma companies are developing these drugs. And for example, we at City of Hope participate in a study of NRX-2127, which is a BTK degrader developed by Nurix. In addition to BTK degraders, there are new targeted agents which inhibit BCL2 family proteins, for example, MCL1. There are several drugs in development there. MCL1 is a pro-survival BCL2 family protein which is expressed in CLL. Then there is BCLx targeting agents. Navitoclax in the past has been developed as a BCL2, BCLx core targeting agent, but has been plagued by thrombocytopenia. But there are now some new alternative modalities which may be poised to avoid the issue of thrombocytopenia. And then there are CDK inhibitors, CDK9 inhibitors in particular. The pan-CDK inhibitors have not necessarily made it in CLL, but it is possible that more selective CDK9 inhibitors, which inhibit transcriptional CDKs, will be more successful, and they are also in development with limited data in the clinic so far.